Hi, I'm Kylie.
I'm Zia. Hi, I'm Zach.
In this video, we're presenting an overview of the Health, Fitness and Wellness Program. This intervention will aim to increase physical activity and provide a healthy, fit diet amongst middle-aged women who are obese. To start off, Zia will provide a brief background on obesity, how it is a big issue in Australia and why it needs to be targeted.
Obesity. Obesity is defined as a condition of abnormal or excessive fat accumulation in adipose tissue to the extent that health is impaired. It is a key issue because it's a major risk factor for the development of several non-communicable disease, significant disability, and premature deaths. Examples include increased heart rate, type 2 diabetes, high blood pressure, certain cancers, which can all result in a reduced life expectancy. According to the Australian Bureau of Statistics 2019, between 2017 and 2018, 2/3 of Australians aged 18 and above were either overweight or obese. Besides the physical effect of obesity, it can also have mental impact. This is supported by Oldham, Tamiyama, and Robertson, who states that feeling overweight could make a person feel anxious about the body, and increased negative effect could result in overconsumption of healthy foods. Through physical activity and healthy diet, which is a key focus point of our program, the negative outcomes of obesity can be prevented.
As mentioned in the previous sections, this program targets middle-aged women aged between 35 to 50. This is because such condition is associated with alteration in the reproductive cycle, with a reduction in fertility, as well as an increased risk of polycystic ovarian syndrome, or PCOS, and infrequent or non-ovulation. The importance of targeting this group is that many middle-aged women tend to suffer from lifestyle-related diseases such as hyperlipidemia, diabetes, and particularly obesity. The contributing factors to these diseases include insufficient exercise, poor quality of food intake, psychogenic stress, and endocrine system imbalances. Additionally, Amano, Subone, Hanafusa, Yamasak, Nishizaka, and Yangasiwa 2015 state that improving body weight, body mass index, and body fat percentage are important measures for promoting health care in middle-aged women and reducing their risk of obesity.
The purpose of the program. The purpose of this program is to help reduce weight for middle-aged women who are obese. By recommending strategies for weight loss, we hope to anticipate a change and aid those middle-aged women who experience obesity.
There are certain measurement tools that are put in place to establish whether there has been any impact on the participants' health and well-being within the 8-week program. Shiroma, Cook, Manson, Buring, Rim, Leal state that it is important to understand the relationship between accelerometer assessment and self-report. Accelerometers, due to their decreasing cost and size, have become increasingly prevalent in both research settings and as commercial products, and are a useful tool when it comes to measuring and showing the role of physical activity in relation to obesity. The data that we will be collecting before the 8-week program commences will be the person's body mass index, weight, and waist circumference. Participants will then begin the 8-week program and follow the exercise and nutritional guidelines that we describe to them. Shiroma conducted some research and found that self-reported questionnaires are reliable, however they are moderately correlated with objective measures.
In regards to the physical training aspect of the program, exercise, pre-exercise screening, warm-up, stretching, and cool-down, aerobic exercise and resistance training will be applied. Before the commencement of exercise in week 1, the individual needs to fill in pre-exercise screening questionnaire. Here's just a video of the type of questions you may need to answer when joining a gym.
So, does anyone in your family under 60 have any heart disease or stroke, any high cholesterol? My dad had high cholesterol, but I've had mine checked. It's fine at the moment. Okay, so yours is normal, so I'll just note that one. Have you been hospitalised recently? No. So you don't have any heart conditions or any heart murmurs, high blood pressure at all? No. Are you pregnant? Not that I know of. Okay. Do you get any pains or palpitations in your chest? Do you have any diabetes, epilepsy? No. Any liver or kidney conditions? Arthritis or asthma? fasting. Not fasting as such, I'm just definitely trying to change my food habits.
That's about it we need to know. So pretty much through this procedure, it helps the staff members to identify whether the individual has any form of medical conditions that may put them at higher risk of experiencing health problems during physical activity. Thus, this procedure is like a safety net to help decide if the potential benefit of exercise outweigh the risk for the individual. Moving on, warm up before and cool down after either aerobic or resistance training needs to be performed in each of the training sessions. These two aspects involve doing exercise activities at a slower pace and reduced intensity. By warming up, it will help the individual prepare his body for aerobic activity, and on the other hand, by cooling down, it allows for gradual recovery of pre-exercise heart rate and blood pressure. Through doing warm up and cool down correctly, it helps to reduce the risk of injury and may also help to improve the individual's performance. Once these previous components are done, the individual can start doing the main training exercises that will help them to reduce weight. To reduce weight, the individual needs to burn a lot of calories. Aerobic and resistance training are the two best methods in burning calories. Aerobic training refers to any type of cardiovascular conditioning. This form of training is a great way in reducing weight as it burns more calories at one time. According to Cross, an exercise physiologist at Dark University, he states that performing aerobic exercises is beneficial for losing belly fat. This training needs to be performed 5 times a week for at least 20 minutes. It can be performed in an indoor or outdoor environment. On the other hand, resistance training refers to any form of exercise that improves muscular strength and endurance. It involves movement of the limbs against resistance provided by the person's body weight, gravity, bands, weight bars, many more. This training is important for weight loss as it increases muscle mass and excess post-oxygen consumption, which will burn more calories at rest. This training needs to be performed 2 times a week after aerobic training. To give you guys a visual insight of how the training runs, I'll be showing several short videos of Carly running through the training session. Switch. Switch. You can switch it. Switch it up. Yeah, you can switch now. You get up and do the other one. And you can switch. So just do like 7. And go switch. Get off. Move the thing to the other side. And do that side. Keep going, keep going. Just in regards to a training program, it's very important for the individual to stay consistent and committed in that 8 weeks program. That means staying committed to your training routine. That means following your diet, eating healthy. In order to see results, you need to apply the principle of progressive overload. This means if in the first 2 weeks you're doing 2 kilometers on the treadmill, next time you should do maybe 4 kilometers in order to challenge yourself, in order to see real results. In regards to resistance training, it's important for the individual to increase the load. So in the first 2 weeks you are lifting 2 kilograms, maybe in 2 weeks time you should lift 4 kilograms, just to apply more stress on your body to actually see results.
In relation to exercise, Molinar van Emmingen Vergui, Grobby and Newmans 2009 states that nutritional guidelines result in a strong reduction of weight and waist circumference in overweight adults. Additionally, adding exercise guidelines to the nutritional guidelines did not significantly reduce weight in adults, but instead it had a beneficial effect on the waist circumference of adults with obesity. The nutritional guidelines in the 8-week program are as followed. Follow the Food Pyramid Australia. Aim for a gradual and sustainable weight loss. Around a modest goal of losing 5 to 10% of your starting weight is realistic, achievable, and has proven health benefits. If you lose weight slowly, it is more likely to stay off. Slow, gradual weight loss from small changes is better and more sustainable than fast weight loss strategies that you cannot maintain. Set realistic eating and physical activity goals for yourself. Don't just focus on the scales, focus on losing excess body fat. Measure your progress by your waist size, how your clothes fit, and how you feel. Losing weight from your waist reduces your risk of heart disease and diabetes. Try to eat regular meals to also avoid overeating. Choose a meal pattern that works for you. For example, 3 main meals or smaller or more frequent meals during the day. Always try to start the day with breakfast. Plan your meals to prevent relying on quick, easy, and often unhealthy foods. Try not to skip meals or follow the fad diets. This will lead to overeating and unsustainable eating habits. Successful eating habits need to be easy to stick to and enjoyable, including some form of protein, such as tuna, eggs, cheese, or beans. Learn to recognize your body's signals for hunger and fullness to prevent overeating. Always ask yourself if you are really hungry or just eating out of boredom. The Queensland Government recommends doing any physical activity is better than none. For example, start with 5 to 10 minutes and gradually build up to the recommended amount. Be active on most, preferably all days of the week, and accumulate about 150 to 300 minutes of moderate or 75 to 150 minutes of vigorous to intensity physical activity each week. And also remember to do muscle strengthening activities on at least 2 days a week.
So the other benefits of weight loss include self-confidence and self-esteem due to the resultant changes to health and well-being. Mentally, we found that it can help overweight and obese people with serious mental illnesses such as schizophrenia, bipolar disorder, and major depression. Also heart disease and dying from heart disease, so overall reduce the risk of disease and illnesses. Also other benefits is quality of sleep and breathing. Overall, National Institute of Health 2013 found that individuals do not have to lose all of the extra kilograms to reap the benefits. So just losing 5 to 10% of their own body weight can start developing major health benefits.
All in all, by following our exercise and nutritional guidelines that were set out, participants will gain understanding of the importance of physical activity in relation to having a balanced and healthy lifestyle.
Physical activity can improve your health and reduce the risk of developing lifestyle diseases such as type 2 diabetes, cancer, and most importantly, obesity. Hence, even performing exercise for as little as 5 minutes is better than none.
Overall, the physical activity and exercise have both short-term and long-term benefits for the body. And most importantly, the implementation of our 8-week program can improve one's quality of life and overall sustain their health and